Sex hormones play a very important role in a woman's life. So in today's video, I want to review what sex hormones are, what role they play in your pelvic health and overall health, and what tests are available to get the hormones checked correctly. So among our sex hormones, we have estrogen, progesterone, and testosterone. And testosterone is quite an important hormone for females, which is rarely discussed with your doctor. And this is so important for women across the lifespan. So what causes low testosterone in the first place? Well, there's a few different things, but what we see very often in the clinic are two different conditions. The use of oral contraceptives or things like spironolactone or Accutane, which are medications that are used to treat acne. Similarly, when young women have acne, they go to the doctor and they are often put on birth control pills. So that can shunt that pathway and it can actually cause issues even later on down the line, even when you come off of those. The second condition is perimenopause and menopause. So this naturally depletes our hormone stores, mostly from our ovaries. We stop ovulating, we can't reproduce anymore, but you still create a little bit more hormone. And that comes from your adrenal glands. And testosterone is often viewed as a male hormone, but women need it too. So I want you to understand how these hormones may play a role in what's going on in your pelvic pain or pelvic floor dysfunction and why they may be important in addition to addressing the musculoskeletal impairments or how they may be involved in creating the issue that you may be dealing with. So specifically, I talked about pelvic pain related to low testosterone because of the use of oral contraceptives or those acne medications like Accutane and spironolactone. So if you have a history of that and you are suffering from painful intercourse, low sex drive, poor lubrication, painful gynecological exams, many of you may think that these are normal. Unfortunately, they're just so common that we often normalize that. But if you've been on one of those medications, or even not, sometimes other things can throw your hormones off balance, it would be good to seek out care from a pelvic floor physical therapist to rule this out, but also to get your hormones tested. So I want to talk about different ways that you can actually measure your hormones. And so the first way is probably the most common, many of you probably have had this before, is a simple blood test or what we call a serum test. So it's pretty accurate and it's very inexpensive generally. You go in, you get a blood draw, but the downside to that is that you're really only capturing what's going on in that moment in time, and it's not really telling you any information about how your body's using that hormone or the downstream effects or the metabolites. And so when you're having or experiencing hormonal deficiencies, which I'll get to later in this video, that may be an important piece of the picture as you may go and get your blood test and everything seems normal, and then you're sort of stuck with I don't know what else to do or what's going on. Then there's a 24-hour urine test, which you do collect at home. It can be very useful for sex hormones and cortisol, but it can be kind of messy. There's a high error rate, and so it's not really recommended and it's not utilized very often. So the test that I'm excited to talk to you about today is the Dutch test. The Dutch test can actually measure your sex hormones and your stress hormones in one test. And so there's different forms of the Dutch test that are more comprehensive depending on what you're looking at, but it is a more comprehensive way to look at what's going on from basically a 24-hour period, but also it looks at your metabolites and what are called nutritional organic acids that are functional markers of different vitamin deficiencies or excess. And those specific vitamins play a key role in eliminating or getting rid of those hormones from your body so that they don't build up in excess. That's especially important for our estrogen because people are very concerned about estrogen-related issues such as fibroids, estrogen-related cancers like breast cancer, ovarian cancer. So it's really important to know what your body's doing with these hormones in addition to how much your body is actually producing. And that's what this test can give you that some of the other tests actually cannot. The Dutch test is also really important if you're really trying to figure out the root cause of your hormone deficiency. Maybe you did get a blood test and it shows that you have high estrogen and low testosterone, but you're not quite sure why this is happening. The Dutch test can also give a better overview and a better picture of where in the process things are going wrong. If you're having persisting hormonal symptoms, and especially if testosterone, you have vulvar pain, it's exacerbated with sex, you have no or low sex drive, you have issues with lubrication, and your OBGYN has just run your hormones and everything's normal. This is a great time to do a test like this to really understand the entire picture. If you found this video helpful and you're interested in getting a Dutch test for yourself, feel free to reach out, give us a call, or head over to our website and schedule a digital health session with myself, Jandra Mueller, and we can discuss which test is best for you.